South Africa is facing its worst unrest in recent years. What originally started as protests over arrests and jailing of former President Jacob Zuma shifted to violence and anger over the country's dire social and economic issues. Now a cleanup operation is underway after days of looting of shopping centres and businesses that disrupted supply chains and transport links. The government has deployed security forces to contain tensions in several provinces. More than 100 people have been killed and over 2,000 arrested. A week after protests started, President Cyril Ramaphosa visited the affected sites and says the economy has been hit hard. Now there are fears of food and fuel shortages. DW's Christine Mhundwa has more on the residents stocking up on basic supplies.
I'm in a shopping mall in Alexandra Township. This is in Johannesburg, and this really is one of the last malls standing in this particular township. And throughout the day, members of the Alexandra community have been coming along to do their shopping here. It's all really been monitored really well. You've had soldiers patrolling the area. Of course, there is some panic buying that's starting to happen now as people fear that they're not going to have access to food and other essentials in the coming days.
We are scared that they will maybe end up not having some food in a long time, eh?
This is one of the malls that was left unscathed and is being protected very much by a number of officials. So in a short while from now, you're going to see members of the South African National Defence Forces patrolling the area, basically just touching base to see that everything still remains calm and in order. Just give us a sense of how much longer you feel that you guys are going to be out here for.
We are going to be here for some time. As long as there's looting and there's burning of warehouses, we are still going to be in the crowd.
Their presence is making it possible for a shop like this one behind me to stay open at this time because, of course, the threat level is still very much alive here.
Well, joining me from Johannesburg to discuss this further is economist Duma Gqubule. Now, Duma, we've seen some of the worst violence in South Africa since apartheid in the 1990s. How did this spiral out of control?
At the heart of it, Rahila, is the ANC government has betrayed the hopes and dreams of our people's liberation. You'll remember that from 1994, when Nelson Mandela became our first black president, until 2020, our economy has expanded in per capita terms by only 18%. So what we've seen now is that what was happening now is we've got overlapping public health, humanitarian, economic crisis. We've also got a political crisis in the ruling party that is at war with itself, and we also have a public safety or security crisis.
This did start off as a political issue over the jailing of former President Jacob Zuma. So is there a political motive behind the latest violence?
Okay, it started off as there is a political grievance, and whether you agree or don't agree with what Jacob Zuma is saying, there is a political grievance that has to be addressed. And I was really disappointed with our political leaders, especially the president, the ANC leadership. When this thing started on Saturday, they should have been on the first plane to the province of KwaZulu-Natal to talk to the people and calm down the situation. Because you can't have a security response that is not preceded by a political response. But now it has morphed into something that's far bigger than the original crisis. We are seeing crisis of hunger. We're seeing people are stealing food. That's been a major feature of this thing. People are hungry. A survey was done in South Africa where 10 million people, out of a population of 60 million people, had gone hungry in April and May when the survey was done. And 3 million of those people were children. So we've got a huge humanitarian crisis at the moment.
Have the COVID-19 restrictions imposed by the government played a part in causing this unrest and anger?
I think, unlike many countries in Europe which have gone back to normal, this COVID situation, the government has botched it from day one. And what happened this year is that they announced another, what I call an over-the-top lockdown, and they didn't allocate even a cent towards the millions of people who would be affected by its devastating impact. And that is one of the many things that happened this year in terms of the bad management of the economy. Because the government started with a budget, one of the most austere budgets in post-apartheid history, where they said they're going to withdraw about 265 billion rands from the economy due to these austerity measures. They cut the social security support that was given to people during COVID, and then they implemented this huge lockdown. So what we have in South Africa right now, we have an unviable society. We've got unemployment amongst young people of 74%, amongst African people, indigenous African people, of about 47.8%. Amongst African females, it's 51.5%. In two provinces, the poorest provinces in South Africa, Limpopo and Eastern Cape, unemployment is about 50%. So we have got this unviable society. We've got desperate people who are starving, and it's totally unviable at the moment. And it's a sub-function of the mismanagement of the economy over a long period since 1994.
So what needs to be done? What's the solution to addressing this level of inequality?
What I've been saying to South Africans right now is that when you have an earthquake that hits you, you start with the humanitarian response. So you provide medicines to the people who have been affected, and you provide incomes to their families and shelter and so forth. What many South African civil society organizations are calling for is a basic income grant that will be paid to people who are between the ages of 18 and 59, without conditions. It will be an unconditional cash transfer to these people. And I'm saying that it can be implemented over 3 years, because what we need is to address the immediate humanitarian crisis. And the studies have shown we are the most unequal country in the world. We've got shocking levels of poverty amongst Africans. The last time there was a survey, 64% of people were classified as under the poverty line. So what this can do is to reduce poverty over 3 years by 66%. And then the next thing we have to do is to introduce universal social security, and that can eliminate poverty as well over the 3-year period.
Duma Gqubule speaking to us there from Johannesburg. Thank you very much for your insights. Now, healthcare services have also been affected by the unrest as South Africa faces a third wave of coronavirus infections. The highly contagious Delta variant is raising concerns the virus could spread even more quickly.
This is great progress for Renee, being able to exercise again.
I came in coughing. Today I'm 100% better. The doctor just came to tell me that all my blood works are excellent. So I'm responding well with the medication.
Reni Naika was lucky to get a bed in this emergency COVID-19 center in Johannesburg. A charity organization set up this ward because public and private clinics are overwhelmed. Now they too are struggling to cope.
It's very straining because there's still patients in the community that are still phoning me from the community for help. And when we full here, then we still need to help them, and we don't want them to be lost to the system.
And the recent unrest in the country could help the coronavirus spread even more quickly. South Africa's President Ramaphosa is concerned.
Our sick cannot get medication from pharmacies. Food does not reach supermarket shelves. And health workers cannot go to work. We will soon be facing a huge risk of food insecurity and medication insecurity in a few weeks. Our vaccination program has been severely disrupted just as it is gaining momentum.
Only about 2% of South Africa's population are fully inoculated. With the number of new infections around 20,000 a day, speeding up the vaccination rate is essential. But amid the protests and looting, that's been difficult. Plus, food shortages make it hard for people to avoid the crowds.
if we have members of the public flocking into the shops and malls to buy foodstuff, we are also risking the spread of COVID-19, and it will go to uncontrollable levels with the Delta variant that is currently prevalent in our country.
In the emergency ward, health workers are worried about the third wave of coronavirus infections.
This wave is a lot more aggressive. It's easily transmitted. Patients are now presenting with more severe symptoms too fast.
Patients here are traumatized. Many were only admitted to this ward when their symptoms became severe.
Not being able to breathe, my son talking to Dr. Manga on the phone all the time, and with him explaining to him, do this with the machine, change the machine, fetch another machine.
You know, this was one experience because you don't know what laid ahead. You know, if you look at the news and see how people are going on, you know, passing away and things, it was the most frightening experience.
If numbers keep skyrocketing, the beds here could also soon be filled. South Africa is the nation worst hit by the virus in Africa, with more than 65,000 COVID deaths up to now.